Thank you so much for that kind introduction and for the opportunity today to talk to you about barcoding and RFID. How can we embrace innovation while dealing with all the challenges? My hope is by the end of this presentation, you'll be able to describe the impact of barcoding and RFID for medication safety. I feel like a lot of the talks earlier have kind of made that already, so that's good for me. We'll be able to discuss some of the challenges with implementation of these technologies, as well as strategize new opportunities that we have with these technologies to enhance safety. So everyone did this survey before. I really appreciate everyone that was able to participate. And surprise, surprise, a lot of us use barcode scanning in our hospital, but not many of us, probably to Dr. Juice's chagrin, use it in our operating rooms. And even if we use it in the operating rooms, we're not using it for every medication. And nobody's really using RFID scanning yet, and it might not be ready for prime time, but we'll still talk about it. So, I skipped some of these slides because my colleagues covered it really well. I think really just big picture, our goal by 2025 is to get to the point where we can have a machine readable code on all of our syringes and our infusions. And that we want to do this not only in our pre-op and our post-operative areas where many of us are doing it already, but we need to be able to find a way that we can do it intraoperatively. We've kind of heard about the barcode medication administration practice. So ideally, you're checking with the patient. Obviously, we can't always do that. So we're at minimum checking with the ID band and then scanning that and making sure it matches the computer and then scanning the medication and making sure it's the right medication and the right dose. And barcode medication administration is not new. It's been around for 20 years, but you can see that even in 20 plus years of a technology, it's still not incorporated intraoperatively. When it is employed, it can decrease non-timing medication errors with an absolute reduction of around 5% and a relative risk reduction of anywhere from 40 to 50%. It's been shown in some studies to reduce adverse events by 17%, decrease medication preparation errors by 50%, and medication preparation time by 60%. In one study, they actually showed that it decreased the length of stay by 4.6 days. That was in a chemotherapy unit, so obviously very different than our OR setting. And they try to make the argument that there could be a potential reasonable return on investment. There's a $2,000 cost of implementation per harmful error prevented compared to the cost of an error, which is anywhere from $3,000 to $7,400. So bear with me with one more audience response system. I probably tortured Arnie with all this, so thank you, Arnie, for your help with this. And I'm really curious what challenges with barcode scanning you've experienced in your hospital. And I know not everyone uses it, but I'd be really curious to see what people are going to say. I have some guesses. And we'll give everybody a moment. I think you can still use that QR code in the corner, and we'll kind of see our word cloud. He said I could do a word cloud, and I got very excited. It's clouding. Look at that. I love it. And I think we're starting to see some themes here. People are like, oh, as soon as you say something, I'm going to start plugging in something else. But but you're seeing a lot of things like the cost of it, the scanner itself, a lot of technical issues involved with it. Wonderful. Okay, so hopefully that will save. Unfortunately, I think this is an older version of my slides, but I'll try to big picture summarize. Unfortunately, there's a big limitation to barcode medication administration, and that is that it cannot completely eliminate medication errors. It does not prevent someone from bypassing the system. It does not stop someone from ordering the wrong medication. It doesn't stop a medication from being labeled incorrectly. And there are other buckets of how these barriers and challenges to barcode medication errors can happen. They can be technological issues where like the scanner doesn't work, or the medication is missing or has an unreadable barcode. And there can also be a lot of processes and system issues. I think a big one that my co-panelists talked about already was time. It takes time to scan the patient, scan the meds, check in the thing, and do all of this prior to administration. And sometimes that lack of time can really translate to increased workload, increased distractions, and that can also lead to people deciding to find ways to work around them. And some of those workarounds can be nullifying for the safety mechanisms involved. And it can also make people really hesitant to want to try to use it, which I think my co-panelists also alluded to. So I wanted to talk about what are ways that we can try to improve our implementation of barcode medication administration. And I think an important thing is to try to have as many medications as possible. Ideally, all of them have a machine readable scan. And ideally, that barcode is actually going to show up on that medication's primary packaging. So I was really encouraged by the talk earlier about how Frenzius is dedicated to doing that. That is going to decrease workload on the end user. And we got to figure out how we can redesign our technology to have it fit within our workflow. It's important that we continually evaluate the barcode medication administration's use. How often are people overriding it? How often are people actually using it with real-time observation? And obviously, we also need to be looking at how we can share what we learn in one institution with other institutions so that we all can benefit from it. I think there are some opportunities for barcoding as well. We've mentioned multiple times how in anesthesia, we're often it when it comes to medication administration. There is nobody to do a double check in 99.9% of my cases. And so, having a barcode mechanism to act as that double check, especially for high-risk medications or for infusions, can be really helpful. We heard about it's important to look at safety too. So looking at different workarounds that our staff use in barcode medication administration can not only allow you to see gaps in the current processes, but maybe a good way that we should try to adapt the system to better serve the end user. And I think it's really important to find ways that we can actually integrate the barcode medication administration system with our electronic health record, with our automated dispensing cabinets, to really make it a more seamless workflow for the healthcare professional. So RFID is a growing field in healthcare. And basically how it works is you have an RFID tag and an asset or a person. It is able to have a unique identification. It is able to store a certain amount of memory. Then you have an RFID reader that has an antenna that can communicate via radio waves and transmit information to, as well as receive information from it. The really important thing about RFID tags is that it's automatic and therefore very efficient. It does not rely on human intervention. There's lots of different types of tags that are out there. The big picture thing to know about them are the ones that have longer capacity or longer distance that they work at or larger memory, tend to be more expensive and tend to be larger. There are lots of different uses for RFID in healthcare already. It's being used for real-time location for patients, for medical staff, for assets. If you want to find that video laryngoscope, you can use this to try to track it down in your hospital. It's used for monitoring medical equipment like gauze, surgical instruments, with the idea that after a certain number of uses, you'd want to take that surgical instrument out of circulation before it breaks in a patient. It can be used for monitoring drugs, especially expiration dates. It can be used in conjunction with wearable technology to be able to have remote and real-time monitoring of vital signs. They've even found a way to use RFID to monitor the pH of a wound to let you know when it looks like it's starting to get infected. That's pretty amazing. So obviously a huge pro is that it has automatic data collection. You can read multiple tags simultaneously from a greater distance than a barcode reader. In one study, it was actually found that it reduced the medication dispensing time by 61% compared to barcode scanning. A big con is the cost and data security concerns. The sensor accuracy may be affected by the power of that sensor, the location of the sensor, how many you have, and they can be susceptible to electromagnetic interference. So even putting a metallic object near it can act as a cage that blocks the RF waves. So how might we use it to enhance medication safety? Obviously, it can help us with patient identification, making sure that we have the right patient, right drug, right dose, and the right time. It can help reduce our medication dispensing time. They have a way with RFID technology to be able to have real-time capture of incremental drug administration from a syringe. So you can imagine it's collecting all that data. You don't need that additional cognitive load of trying to chart the infusion change that you made on the pump. It can improve the stocking of carts, our anesthesia carts, our drug trays. It could notify you if there's changes in vital signs in response to a medication. And it should be helpful also in identifying any counterfeit drugs that does not have the proper RFID tag. So asked before my talk and how effective people thought barcode or RFID would be. And it seems like the majority of people think it would be effective in helping them reduce medication errors. And so now it's really on us to figure out how do we make it attainable? How do we make it cost effective? How do we make it work in our workflow? So in summary, barcode and RFID technology can decrease medication errors. There's obviously huge barriers for us, especially technical issues, time pressure, and cost. Trying to learn from the workarounds and find ways that we can really integrate into our workflow are necessary for us to be able to successfully adopt it.